FNP 652 Final Exam Newest 2026-2027 Actual Exam with complete questions and correct detailed answers verified answers. Question 1. PG1. FNP 652 Final Exam Newest 2026-2027 Actual Exam with complete questions and correct detailed answers, verified answers. Already graded A+. A patient presents to the clinic with asthma symptoms and a peak flow of 75% after one puff of albuterol. What is the next action? Repeat. Albuterol will only punt to ed if PF 70%. Repeat. Albuterol will only punt to ed if PF 70%. Question 2. A patient presents with acute asthma symptoms that is currently on albuterol PRN only. What is the next plan? Oral corticosteroid. Follow closely. FEV1 less than 40% needs to go to ed. Oral corticosteroid. Follow closely. FEV1 less than 40% needs to go to ed. Question 3. A child presents with cough, low-grade fever, and wheezes in all lung fields. What do you suspect? Atypical pneumonia. Atypical pneumonia. Question 4. Which TX may be used to manage bone pain in patients with bone tumors? Biphosphonates. Exercise. External beam radiation. Vertebroplasty. Biphosphonates. Exercise. External beam radiation. Vertebroplasty. Question 5. PG2. A young adult male reports a dull pain in the right scrotum and the provider notes a bluish color showing through the skin on the affected side. Palpation reveals a bag of worms on the proximal spermatic cord. What is an important next step in managing this patient? Consideration of underlying causes of this finding. Consideration of underlying causes of this finding. Question 6. A preschool-aged child with no previous history has mild flank pain and fever but no abdominal pain or vomiting. A UA is positive for leukocytes and nitrites. A culture is pending. Which is the correct course of treatment? Order augmentin. Order augmentin. Question 7. An elderly female without prior history of CV disease reports lower leg soreness and fatigue when shopping/walking. The PCP notes decreased pedal pulses bilaterally. Which test will the PCP order initially to evaluate for PAD? ABI index, Doppler ankle/arm index. ABI index, Doppler ankle/arm index. Question 8. A pregnant woman at 30 weeks gestation has proteinuria. What will the provider do next? Evaluate her BP. Evaluate her BP. Question 9. A patient has been taking terazosin daily at bedtime to treat BPH and report persistent daytime dizziness. What will the provider do? Prescribe finasteride instead of terazosin. Prescribe finasteride instead of terazosin. Question 10. A 3-month-old male infant has edema and painless swelling of the scrotum. On physical exam, the provider is able to transilluminate the scrotum. What will the provider recommend? Doppler US. Doppler US. Question 11. PG3. The provider is evaluating a patient for potential causes of urinary incontinence and performs a post-void residual test which yields 30 milliliters of urine. What is the interpretation of this result? This is a normal result. This is a normal result. Question 12. The daughter of an elderly, confused female patient reports that her mother is having urinary incontinence several times each day. What will the provider do initially? Obtain a urine sample for UA and possible culture. Obtain a urine sample for UA and possible culture. Question 13. A patient reports abdominal and back pain with anorexia and nausea. During an exam, the provider notes a pulsatile abdominal mass. What is the initial action? US of the mass to determine the size. US of the mass to determine the size. Question 14. An older male patient reports urinary frequency, back pain, and nocturia. A dipstick UA reveals hematuria. What will the provider do next to evaluate this condition? Order a PSA and perform a DRE. Order a PSA and perform a DRE. Question 15. A 70-year-old male patient has an aortic aneurysm measuring 5.0 centimeters. The patient has poorly controlled hypertension and decompensated heart failure. What is the recommendation for treatment for this patient? Serial ultrasonographic surveillance of the aneurysm. Serial ultrasonographic surveillance of the aneurysm. Question 16. An adolescent has right-sided flank pain without fever. A dipstick urinalysis reveals gross hematuria without signs of infection or PG4, bacteriuria, and primary care pediatric nurse practitioner diagnoses. Possible nephrolithiasis. What is the initial treatment for this condition? Increasing fluid intake up to 2 L daily. Increasing fluid intake up to 2 L daily. Question 17. According to current research, which are associated with a decreased incidence of stroke, intensive insulin therapy in T1DM, Mediterranean diet, -7 servings of fruits/veggies per day. Intensive insulin therapy in T1DM, Mediterranean diet, -7 servings of fruits/veggies per day. Question 18. A 50-year-old man reports having erectile dysfunction. What is an important response by the provider when developing a plan of care for this patient? Evaluating the patient for cardiovascular disease. Evaluating the patient for cardiovascular disease. Question 19. The mother of a 12-month-old uncircumcised male infant reports that the child seems to have pain associated with voiding. A physical examination reveals a tight, pinpoint opening of the foreskin, which thickened and inflamed. What will the nurse practitioner do? Refer the child to a pediatric urologist. Refer the child to a pediatric urologist. Question 20. During a well child examination of a 2-year-old child, the PCP palpated a unilateral, smooth, firm abdominal mass which does not cross the midline. What is the next course of action? Refer the child to an oncologist immediately. Refer the child to an oncologist immediately.